feel off, maybe fatigued, foggy, can't sleep, have IBS symptoms, achy, and you just can't figure out why? Could it be an autoimmune disease hiding in plain sight?
The answer is coming right up. Here we go, everybody.
Hi there, I'm Anna Manuel, co-host of Transform Table Talk Live, alongside Dr. Maggie Yu. Hello, Dr. Maggie.
Hey, everybody, and welcome. And just for those of you that are new, I am a functional and holistic medicine physician in practice for 27 years at this point. And I love focusing on autoimmune disorders, hormonal imbalances, and mystery illnesses that no one else can deal with, diagnose, or treat, or know how to turn around. So today we are going to be blowing the topic up on autoimmune diseases. And go for it.
Well, I was just thinking, you mentioned the things that you love talking about: hormonal imbalance, mystery illnesses, autoimmune disease. And it begs the question, it makes me think about the reasons why you might like that. And I know it's partially because you lived all of those things.
Yeah. This really started for me, like, it's like a full circle journey, right? I graduated from UCLA, one of the top medical schools in the country, and I became a family medicine physician. And I practiced in family medicine for the first 10 years of my career, and I was very, very good at it, took a lot of pride in it. And I was also medical director of a large medical group where I was training young physicians on how to be well-meaning, well-practicing family medicine physicians. And as part of that process, I had a family, ended up having 2 kids, and ended up getting really, really sick with multiple mysterious symptoms that are extremely common, that were what we call eye roll symptoms. And as I'm listing off some of these symptoms that I accumulated, everybody in chat, I want you to start telling me which one or ones you had, and just start keyboard warrioring it in chat. I noticed that I had fatigue, and not just fatigue, chronic fatigue, and fatigue so bad that I was sick and tired of being sick and tired. And it wasn't just physical, it was mental as well. Brain fatigue. And some people would explain it as brain fog. How many of you know what I'm talking about? Type it in chat. I started developing, I've always had, but it started getting worse with some of my gut related symptoms. I had severe bloating. Food felt like it either moved through me or it was stuck, and I was dealing with a lot of chronic constipation. Chronic pain, started to get diagnosis of fibromyalgia. My concentration was so poor and my brain fatigue was so bad, I was diagnosed as having adult ADD. Never had it earlier in my life. And I started gaining a lot of weight, losing a lot of hair, and developing a lot of mystery nerve-related type symptoms, neuropathy. How many people develop nerve pain, TMJ, fibromyalgia, and there wasn't even, and all my workup that I knew to do on these eye roll symptoms were negative, like many of the patients that I was seeing. And then coup d'etat was around the age of 36 when I developed early menopause. Verified by blood work, I was in menopause. And that's when I had more eye rolls from my colleagues that was like, Maggie, you're just getting older. And so for me, hormonal symptoms, along with all these mystery unicorn and orphan illnesses, was what my entree into this whole realm of chronic diseases that really are difficult to diagnose with normal labs, that were really difficult to treat without any answers. And it got so bad that at around age 36, and hear this, after each of my children, that was 30 and 33, things just got worse and worse. So clearly there was staging to this that correlated with hormone changes. But when I went into early menopause at the age of 36, my world literally fell apart. I lost my job, I lost my marriage, and I nearly lost my life. And that's when I really, as an intelligent woman and medical doctor, there's no more bottom to hit there. And I had to say, there has to be something that I can do to put on my MD smarts, that I can learn, add, implement, that I could put together that would turn this around. And that's when I literally had to go out of the box. And that's why my book is called 8 Out of the Box Ways to Transform Your Health, because in that box, there were no solutions, no diagnosis, no tests, no solutions. So I had to figure that out. And so, this was 18 years ago. I figured it out by putting both conventional medical practice and training and wisdom that I had, along with all the naturopathic functional medicine training that I had, and put it together. And I was able to understand what were really causing these problems. And that's what brought me well into the realm of autoimmune diseases, or diseases that may involve the immune system on multiple levels, that most of them cannot and haven't been diagnosed, that have clear patterns and answers to them, because they are treatable and they're reversible. I did it first in myself. And then over the course of the last 18 years, I've been able to do that for thousands and thousands of patients and people that I've worked with. So that was my journey into this.
Repeatable results, though. You mentioned that you were patient zero, but you have been able to then find the patterns in this, know that there's all kinds of connections involving the immune system.
Yeah.
While the symptoms may seem very different, vast, people have different symptoms, you can treat them all the same way and everybody can get results.
I don't know if you can treat them the same way. I think that what's causing them
is the same.
You could put into certain groups that are patterns. So you do not, and I definitely do not think that any person with these types of symptoms can be treated the same way. But what's interesting is the underlying things that cause these symptoms is very similar. It's very similar. There are clear groupings and clear connections that doctors really are missing. And here's some statistics. I just want to actually go through some statistics. And Macy, thank you for saying, fibromyalgia, IBS, and fatigue. How many people out there have fibromyalgia? And did you know that it was related with your immune system? How many people with IBS know? And how many of your doctors know that IBS is BS as a diagnosis? Because it actually, irritable bowel syndrome isn't even really about the bowel. It's about certain branches of your immune system going haywire. So did you know that IBS is related to an immune system dysfunction, right? What about, she said fatigue. Did you know fatigue and chronic fatigue, long haul, these chronic fatigue type syndromes are related to your immune system? How many people know that out there? Because your doctors certainly don't. And that's what we're here to talk about today.
Well, and look at how so super smart Sandra is, saying, I'm guessing my severe dysautonomia, if it had a root cause, it would be autoimmune. And she also does have other antibodies that she's lucky enough, we'll say lucky enough, to show up. Because I know you've mentioned to me before, and you alluded to it, that there are so many other autoimmune diseases out there that we just don't even have tests for. We don't have names yet for them.
Mm-hmm.
What was the statistic you shared with me about that?
Well, let's talk about the statistics here. Do you know that even by the best and highest estimates, less than 20% of autoimmune diseases have a name and a diagnosis associated with it? That means that 80%, the vast majority of diseases that involve some branch of the immune system, haven't been identified as being related to the immune system or autoimmune disease at all, even though they are. That means that what we know and what we can identify as being classic autoimmune diseases involves around 100 diagnoses. That's it, okay? Involves about 100 diagnoses. And by the best estimate, the other 80%, which means the other 800, 900 of those diagnoses have no test, no name, and no actual awareness from your doctors that they're related to the immune system at all. And
then that sets you up for complete failure, because if they can't give you something that they can put their hands on to diagnose or get a test for, a lot of times you'll get pushed to the wayside and say, there's nothing wrong.
Correct, because all the standard labs are normal, right? Or even expanded autoimmune labs are normal, right? But if our labs are that limited and our diagnostic names are that limited, that means 80% of people walking around with an immune system problem is walking around with no diagnosis or the wrong diagnosis, or being lumped with a psychiatric diagnosis. Recently, in a study around POTS, It was a study that found that 76% of patients with mystery illness, POTS is an example, postural orthostatic tachycardia syndrome. You and I know, and I've talked about in many of my trainings, that it is linked with multiple problems with the immune system. It is an autoimmune disorder.
May I share a story about that after you're done?
Zero doctors that you will talk to besides me will say that, because they don't know that. So what you're hearing here is new, and it's 20 years ahead of what the research and clinical treatment is going to come out. We are 20 years ahead of the research and the pattern recognition that the data is going to come later. It's 20 years behind in clinical medicine right now with diagnosing something like POTS. And the current study around POTS shows that 76% of POTS patients were previously diagnosed and misdiagnosed as having a psychiatric disorder instead. And I'm going to also say something else. There's also a bias with these mystery, unicorn, or orphan diseases. They inordinately affect women more than men. So even if you look at the autoimmune disease data, more than 63% of people with known autoimmune diseases are women versus men, right? So what you're finding is, in that scenario, if 80% of autoimmune disorders aren't even diagnosable or diagnosed yet, then vast majority of those people are women walking around without a diagnosis, right? And without their doctors even having any awareness that their symptoms are related, and it's related with their immune system. And you shared a story, and I'll share even a story. This is commonplace because you and I know this, and my audience knows this. How many of you have heard me and know whatever the syndrome that you have, that you know is autoimmune related? I'm going to list some things first, okay? We're going to talk about fibromyalgia, POTS, dysautonomia, long haul, IBS, mast cell activation syndrome, histamine intolerance, autism spectrum, chronic hives, Raynaud's syndrome. Did you know Raynaud's? Just so you know, it's autoimmune. How many people know that? Which is like arteries spasming in your hand and in your toes, where they turn blue or white or super cold, right? That's Raynaud's, autoimmune. Okay, how many doctors know that? How many of you know that? And we know that because it's linked. It's much higher in people with scleroderma and lupus, for example, other autoimmune disorders. So Raynaud's is autoimmune, right? And then look at things like migraines. Even migraines is much higher in people who have lupus, scleroderma, rheumatoid arthritis, and Sjogren's. Is migraines part of an autoimmune syndrome, right? Interstitial cystitis. Just talked to someone earlier this week around that. None of her doctors had any awareness over the past how many years or months of $1 million workup that has anything to do with her immune system. But yet people with interstitial cystitis frequently have other autoimmune diagnoses added on later, like lupus, for example. Endometriosis, a hormone disorder, is linked with elevated many different types of antibodies that are against self. We call them autoantibodies. Endometriosis is also linked with other T cell dysfunction, which is parts of your immune system. So is endometriosis, which we think of as a hormonal problem, related with an immune system problem? Right. Chronic fatigue syndrome. So the list goes on and on, right? So, Anne, you and I have conversations with people. I just had one with someone about their interstitial cystitis. You had one with someone with POTS this week. Share your experience trying to have that conversation.
Right. I was with a group of moms from my child's school, and they were talking about some of the strange health symptoms that they were dealing with. And I asked the woman who was sharing, do you have autoimmune disease? Because she was listing all of these things that we had mentioned earlier. And it's just sounded very autoimmune to me because I've been educated by Dr. Maggie. And she said to me, straight face, oh, no, I don't have autoimmune disease, but I do have POTS. And I looked at her and I said, so there is an immune component here, right? That has been shown to be connected to dysfunctional immune system, perhaps autoimmunity. And she looked at me like I had three heads. Never had she heard that before. And she's been dealing with this POTS journey for many years, and nobody mentioned it to her. And she said, well, I've never, gone down that path. I have a heart problem. It's a heart problem that I have. And I said, oh.
I literally have about 10 to 20 training videos around POTS, and we have about 10 to 20 case studies around POTS. where all of these people were sent to cardiologists and were told that they had a negative workup for all their $1 million heart workup, including tilt table tests or Holter monitor, EKGs, ER visits, cardiologists. One of the biggest patterns that I see is something like POTS is frequently going to the cardiologist because the symptom has to do with faster and slower heart rate or blood pressure changes. So you think cardiovascular and heart related. But it's actually not a heart problem because all the heart workup is negative because it isn't a heart problem. And so for me, and I was talking to someone this week about interstitial cystitis, which is it hurts when you pee. And this is really a common scenario where someone for years, and I had interstitial cystitis, where for years you go to the doctor thinking you have a urinary tract infection over and over again. And rarely is a culture done, but when the cultures are done, they're negative. And so it's not an infection, right? And then you go and get the CT scan, you get this scope, that scope, only to find out normal. And you've had that experience, where people tell you your ureters look normal even after surgery or something like that, right? And for me, I was having this conversation and I was like, well, because many people with interstitial cystitis, meaning it hurts when they pee, it's not actually a bladder problem per se or a urinary tract problem. It actually, in my experience, is related to your own immune system misbehaving and starting to attack different body parts as if they're a germ. There's nothing wrong with the anatomy, right? There's no infection going on in the case of interstitial cystitis, but there's some mechanism with which your body is looking at a part of your body as a germ and it's actively trying to attack it, causing pain, inflammation, right? And those symptoms. And like you, when I start to explain this, sometimes people look at me, well, frequently, as if this is the first time they've ever heard of it. And it is because their doctors have never heard of it. Right. There's not even a consideration that some of these diagnoses have anything to do with a hyper-triggered immune system, which is why
we are speaking to the audience because Claire, who mentioned earlier that she does have POTS, says she's wearing the monitor right now. I assume the heart monitor, and she's waiting to get into the cardiologist. And I know she is trying to go through the steps to get help, to feel better. Yeah. But unfortunately, will the cardiologist be able to provide her with any viable solutions?
The evidence says no. The evidence says no. When you actually look at the outcomes for POTS, dysautonomia, and long haul in the conventional medical setting where people are being sent to cardiologists, the cardiac meds don't work for the vast majority of patients or have side effects that are intolerable. The compression stockings, the salt, it actually is not identifying what's really the real cause of the problem when it's an immune system problem or other types of problem, right? So let's talk a little bit, everybody, about what is autoimmune, because that's what the focus is today. Mm-hmm. So autoimmune means that your immune system is auto-attacking yourself. That's not what it normally should be doing. So what is the function of an immune system? Let's think it through, everybody. So let's learn together and write this down, okay? Number one is that your immune system is supposed to identify a germ outside your body or trying to enter your body and says, you're a germ and I'm going to kill you. Okay, it's anti-infection, right? Mm-hmm. So number one. Now, think about this. If your immune system isn't very good at identifying germs and killing them, what's the result of that? Multiple different types of infections around your body. So do people with chronic infections of any kind, whether it's long haul, whether it's sinus, dental, urinary tract, vaginal, gut, do you think that is a dysfunction of their immune system, meaning their immune system isn't doing what it's supposed to do on this branch? Yes. So this is an immune system disorder, number one. Okay. The second task of the immune function, okay, is there's another system. It's in the allergy branch. So your immune cells, defense cells, are also there to identify something that's an allergen. Doesn't belong in your body. Says, you're an allergen. You're not good for me. I'm going to identify you and we're going to attack the heck out of it to basically protect the body from something allergenic, irritating, doesn't belong in the body. Okay. That would be the allergen branch of the immune system. Now, when the allergen branch of the immune system doesn't work properly, What can it do? Well, it can start misidentifying or hyper identifying many, many, many things as an allergen, and then you hyper react to every more and more and more things. So, does it make sense to you now that mast cell activation syndrome, histamine intolerance, right? Or increasing food reactions? Yeah, all of these is related to some sort of dysfunction of the immune branch that relates with allergens, right? That's an immune system problem, right? And so that's another branch that can go wrong, right?
Mhm.
Think about what another branch, third branch of the immune system I'm going to identify is the branch that is anti-cancer. So let's talk about that. Your immune system, when it's working properly, is supposed to survey your body and look at your healthy cells and says you're good. But when it sees a cell that looks different, like a cancer cell, it identifies and says, I don't like you. And I'm going to start sending immune system cells to try to get rid of you because you look really funky and crazy to me like a cancer cell. So, doesn't it make sense that people with sort of any branch where their immune system is not working properly, that their ability to survey their body for cancer cells starts to go down and they're at risk and they actually experience more and more cancers?
Yes, and that makes so much sense. And some people wonder, why is that? Why is there a connection with people who do have definable autoimmune diseases that they're more likely to get particular types of cancer? And you just put it into words perfectly as to this is the reason your immune system is malfunctioning.
Correct. So, what I'm going to tell you is I just named a whole bunch of disorders, including cancer, multiple infections, mast cell, POTS. I just named all sorts of disorders. And can you see that all it takes is some part of that, one branch or a different branch of the immune system, one branch to misbehave, misidentify, mislabel, overfire, underfire to cause symptoms.
Mhm.
And it can be symptoms all over your body. And it usually is multiple different targets, which is why I actually want to give a new disease label for everybody so we can have a better conversation here, which is the acronym MIST, MIST. And I want you to write it down. And I talk about this all the time with people that I work with. It's what it is a syndrome. It's a pattern of disease that's called multisystemic immune symptom targeting. Okay. So the immune system, your immune system involves every part of your, like every part of your body. Is your immune system related with your dental health? It's your immune system related with ear, nose, and throat that can impact balance and hearing? Is your immune system related to allergy and histamine reactions? And if you have an allergy and histamine reaction, can it affect your circulation? Think about this. I'm just going to tell you something, okay? Let's say you have a lot of allergic histamine reactions, right? So you eat something and your body starts to swell up. Let's say your face swells up, your lip swells up, your hand swells up. Well, that involves increase your cardiovascular blood vessel system to identify allergen, red alert, then sends histamines to go up. And histamines will cause your blood vessels in that area to dilate, open up, increasing in more blood flow to that area so that your immune system can go work against that allergen. The symptom is actually cardiovascular, meaning it looks like redness and swelling in an area is blood flow.
Mhm.
Does that mean this is a heart problem? Does this mean you should go see the cardiologist?
It's not going to get you very far.
Right? So I want you guys to have a bigger understanding that multisystemic immune symptom targeting, then you start to understand, wow, when my immune system is involved, whatever branch is misfiring one way or another, it is going to impact the other branches, and it involves multiple organ systems.
I really want to underscore this because this is something that you have coined, right? This is something that you have discovered to be this new range of symptoms and
The pattern, yeah.
a pattern. And because of that, you're now able to encompass so many of these things within it and be able to explain, hey, you actually do have something going on with your immune system. I've seen it before. I've seen it thousands of times, and I know how to handle it.
Well, look at Amy's example right here, right? So when we think about MIST, multisystemic, right, immune symptom targeting, Amy, here's an example, and everybody else chime in here on what you're starting to connect the dots on. She has diabetes type 1, which we think of as a blood sugar problem.
But
right?
what is it really?
It's an autoimmune disease involving the hormone making cells in your pancreas. So it's actually an immune system dysregulation where it misidentifies hormone making cells as a germ and it's actively trying to kill them, or it's actively trying to kill them. So think about people with diabetes, okay? If your body already looks at your pancreas hormone making cells as a germ and is killing them, do you think people with that sort of immune hyper triggered reaction against hormone cells are going to start attacking thyroid? Because those hormone making cells in your thyroid makes hormones and they look identical to your pancreas hormone making cells. What is the correlation then? Someone who has diabetes, because it isn't just a blood sugar problem, also has multiple other hormone making organ problem like thyroid problem like Hashimoto's or Graves, right?
It's the case for Amy. She has that as well.
And has multiple hormone, ovarian sex hormone problems like PCOS, endometriosis, early menopause, right? And we'll have other hormone making problems like adrenal hormone making problems. So they're going to have a lot of stress, nervous system disorders with panic, elevated heart rate, POTS, dysautonomia, right?
Ding, ding, ding.
And how would that impact on the hormone making cells on your brain? Your brain makes hormones. So do you have anxiety and the psychiatric new disorder all of a sudden of ADD or anxiety? Or do you have a pattern of MIST where your immune system is starting to identify these hormone making cells in your brain as a germ and it's attacking them and it impacts them? And now you have symptoms of that, right? So Kim Miller says she has PCOS,
just like you were saying,
hormone problem, right? Hormone targets, POTS, a nervous system attack against the nervous system, and the hormones associated with the nervous system, like adrenaline, hormones. Okay. And she also has mast cell and histamine like issues. Allergic branch of her immune system is affected. This is like Kim, and here's the thing. We talked about I named several branches in the immune system. And you could already see like the first branch I talked about was anti-infection, right? And I wonder in Kimberly's history, and she can type in chat, did she have history or current history of like chronic infections? That people just said, oh, you have chronic UTIs, you have chronic sinus infection, or you just have bad cavities, or you have Lyme, or you have long haul, right? Is that separate? Or is that part of a pattern that Kimberly has, right? And I'm not like sort of medical savant here. I'm just showing you that this pattern exists with MIST. And that's MIST because she has a hormone problem. PCOS is a very frequent, polycystic ovarian syndrome is a frequent pattern of people with immune system problems. So part of MIST is typically, many of them have PCOS as one of the hormone patterns, right? And Kimberly just wrote, she has also small intestinal bacterial overgrowth. She has also more infections than other people, more allergic branch reactions than other people, and more hormone problems than other people. And now from the infection branch, you can see she had a bowel infection, chronic sinus infection, and dental infection with cavities, all related. And it's this one syndrome of MIST.
And you mentioned cavities, and that is really something that many people would say is left field. They never would have thought about that, how your oral health is also connected to your immune system in that way.
Well, when I tell you that clinical practice is 20 plus years behind, I am not kidding, because I am up on the latest training in not just conventional medicine, but functional medicine as well. And I would say about 8-9 years ago, I was really talking to my colleagues a lot about how, as I'm noticing this MIST syndrome, I'm noticing as I'm evaluating infection, I'm evaluating histamines and their allergy branch, their hormones, these different root causes of this problem. The pattern that I saw was that an inordinate number of these people had dental problems with cavities, gingivitis, with implants, And that I was seeing that pattern over and over again. And sure enough, several years later, Institute of Functional Medicine started to train physicians with awareness of more and more of a growing field called biological dentistry, which is that even dentistry now is starting to jump on board and starting to recognize that these chronic infection types of patients with their health in other areas, there's a connection with their teeth and their what we call the dental microbiome with their teeth. There's an whole immune system in your mouth. And by the way, the whole immune system in your mouth is linked with the ear, nose, throat, as well as your gut. It's all connected.
By the way, she says she used to have those problems. She no longer has them because she's a graduate of your program and you fixed it, as she calls it. You did what her doctors for however many years could not accomplish.
So here's the thing, everybody. The title of this today is What is Autoimmune? And I just explained some of the multiple branches, right? And here's another piece around this is you may have an autoimmune diagnosis, right? How many of you out there have an autoimmune diagnosis? Because we've just talked about a whole bunch of people who didn't know that they had an autoimmune illness, right? Here's the missing piece. How many of you have those unicorn illnesses or symptoms and you already have something that you know of that's already an autoimmune diagnosis, right? It's the coexistence of autoimmune disease, known diagnosis. That is a major clue that everything else is related to this MIS syndrome, right? But the problem is, like for me, I'm using myself as an example. Amy was a great example. I'm going to use myself as an example, right? I went to early menopause. No one says that was related to my immune system, right? I had fibromyalgia. I was actually diagnosed with having anxiety instead of fibromyalgia. And no one thought it was related to my immune system. And it wasn't until probably 4 or 5 years later, I diagnosed myself as having an immune system problem, an autoimmune disease of Hashimoto's on my thyroid, right? And still then, they didn't think that that was linked with how would an autoimmune disease, an autoimmune immune system attack on your thyroid be linked with your early menopause or your fibromyalgia or my recurrent urinary tract infections that was later diagnosed to be interstitial cystitis, or my IBS, multiple, years of constipation and bloating and indigestion, right? People just didn't link known autoimmune conditions with all these other mystery symptoms.
Yes.
So Clara Frank says, 35 years of Sjogren's, dry mouth. How many people have dry mouth, low saliva, dry eyes, and there isn't even a thought with their doctors that this could be signs that it's linked with other autoimmune conditions that they may have already diagnosed or can't diagnose, right? Claire, and I don't know you, Claire. So isn't it interesting? I don't know Claire, but she's sitting here talking about how, and I happen to have 6 root canals, 11 crowns. It's attacked my teeth. It's awful. Don't even eat sugar, and I brush my teeth. She has
good oral hygiene, but yet is having all of these mouth problems because there's something else going on.
Right. That's absolutely right. And Claire, and ding, 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 ding. I hope this is ringing an alarm bell in everyone here that this is a real syndrome, multisystemic immune, right? Symptom targeting, meaning multiple targets throughout the body are targets. And the reason that this isn't identified in our conventional medical system and our conventional medical system isn't designed to deal with this is the multisystemic part of this. Okay. I'm just going to tell you something. When I listed the different branches of the immune system, I can already tell you right now, you think, oh, if I go to an immunologist, that's going to solve this problem. Right? Well, no.
And I want to ask you about that because multiple people on here have mentioned having Epstein-Barr, EBV. Queen Hearts mentioned it, and Sandra mentioned it as well. And when you hear about that virus, how does that play a role in all of this? Is there a connection as well for that reactivated EBV?
It's not just Epstein-Barr. Let's look at, I call these super infections. These are super triggering infectious agents, okay? So that's Epstein-Barr, that's Lyme, it can be adenovirus, it can be COVID and long haul, right? There are certain types of infection and even bacterial infections. Think about mycoplasma. There are multiple types of C. diff. There's certain types of bacterial infections and even fungal infections that when it infects your body, it doesn't just infect one system, it infects multiple systems. Think about long haul, right? When you get long haul, why do you get chronic fatigue? Why does it impact your smell and your nerves? Why does it cause nausea and stomach irritable bowel syndrome? Why does it cause people to then suddenly have more and more allergic and histamine related reactions? And why does it cause someone to have severe hormonal changes that seem to come out of nowhere, right? Because that particular agent that's infects multiple systems within the body, triggering multiple areas of immune reactions in the body. And who are you supposed to see for that problem? Which specialist does this really involve?
You're going to bounce around.
Well, and the person with Epstein-Barr, Sandra, how many, and the Epstein-Barr virus attacks her nervous system. So think about this. I've talked about how people with long haul have an extremely high rate of developing POTS and dysautonomia, which for people who don't know is a disorder of the nervous system that people send to the cardiologist, which involves elevated heart rate and slow heart rate, elevated high blood pressure and low blood pressure, vertigo and dizziness, right? And severe anxiety attacks, brain fog, and brain fatigue, right? And that's would be a nervous system disorder. But guess who these people get sent to, right? You got long haul that trigger all these symptoms. And Sandra's smart enough to say it's a nervous system disorder, right? But she and many other people are going to be sent to the cardiologist. What does the cardiologist know about your immune system or your nervous system, right? Or about Epstein-Barr or COVID?
It's not in
Nothing. Zero, zip, zero, nothing. Right?
Meanwhile, here's someone in your program who's only been in your program for 2 weeks. She says, I already have more answers from Dr. Maggie in 2 weeks than all of the specialists I've seen in 42 years.
Yeah, thank you. Thank you. And that's the piece that I really want to bring it on home, right? The question here today we're answering is what is autoimmune disease? And I just mentioned to you that there is a very big underdiagnosis and a misunderstanding of autoimmune disease. And people are also because it involves so many systems, people are being sent to all the wrong doctors because of how fragmented our medical system is, right? Who's the master of multisystemic immune disorder that targets multiple symptoms? There isn't a doctor out there that really understands this syndrome and is the masters of understanding all the different targets, except for someone who's actually lived through it, had to solve it and teach it, right? So for me, I think that is I am very blessed and I'm very thankful for my mom who went through some of these symptoms, and my mom passed away from ALS. And for my own experience and my own unique background of being a medical doctor, and then later receiving all the training with functional medicine to be like, hey, you know what the cool thing about this is? I know the pattern. I see the pattern. People are not crazy, mean, or lazy. Okay. This is a clear pattern. And there are clear root causes of this immune dysfunction, right? And it is fixable. This is the piece. It's fixable.
And a lot of people are asking, okay, and maybe you can share a little bit. I know that's not the topic of this, but what can they do and how does working with you, what does that look like?
I think before people even think about working with me is that what is your level of curiosity, your level of openness, and what is your emotional reaction to hearing what you heard today? Like, really check in with yourself and type it in chat and be really honest with me. Is what's one word to describe your emotional reaction to hearing, seeing, and feeling the connections that are being made for you today? Right? Put it in chat. I dare you. I challenge you. I invite you. Right? Because that's the piece that I would say in the vast majority of doctors that I have worked with, and they're sick themselves, right? Is that the difference between someone who's successfully able to turn this around, someone who isn't, has to do with curiosity and openness. If you're neither curious and you're not open, then you have an agenda and you have judgment, right? Many of our doctors have that towards their patients, and many of us have that towards our own health. And then when we hear something that's new, different, outside our agenda or judgment, sometimes there's a lot of resistance or defense around it. So Miss Jackson says, overwhelmed. Yeah, how often is that her go-to? And it was my go-to, right? If this is overwhelming for you, then you are stuck in a state of overwhelm, right? And so really importantly, what's the counter side of overwhelm? Let's talk about the opposite, right? We have choice here. Overwhelm doesn't just happen to you, it's a choice. But you have to be aware of it. That's why I dare you to put in chat, what is your emotional reaction to this? Because your emotional reaction isn't happening to you, it's happening for you. And the first step is when it happens, and we had this conversation yesterday, Anne.
Yes.
When it happens for you, you say, okay, I'm overwhelmed. Great. The first tool you should do is, what's the opposite of overwhelmed? What is the opposite of overwhelmed? Right? The opposite of overwhelmed would be what? This is like doable. It's open. It's overwhelmed, could be underwhelmed, as in like, I've been very underwhelmed with what's happened so far. Right? And, I think you should be underwhelmed with everything that's happened to you so far. I'm underwhelmed, right? And when you do get the other side of underwhelmed with that is the opposite, right? When you're underwhelmed with everything that's happened in the past and you turn in this direction and there's coming at you, isn't this what you've been needing or wanting or needing? What's the opposite of underwhelmed with all the care that you've had is I am welcoming this flood of solutions, education, and answers and confidence, right? Yeah. So it's really starting to think about like, where am I at? Where am I stuck? Right? And what's the opposite of that? And thinking about what is the opposite of that? And just starting to play with it yourself, right? So for me, are you ready to really be getting a flood of new information, right? New answers, new solutions. And are you ready for that evidence? Because I want you to have evidence. This is why on our YouTube channel, think about, if you go to my YouTube channel, if you're not watching on YouTube right now, hop over. We'll put a link in chat to go over to the YouTube channel. As of the time of this recording, we have 47,000 subscribers, right, to the YouTube channel. And we are at almost, I think, 1,500 or 1,700 videos in there. And about 400 case studies in there of people with every symptom known to man, every diagnosis and known and not known to man, and how they got better. So example, if you have gastroparesis, look up gastroparesis and Dr. Maggie Yu. Okay, you're going to find case studies around that. If you have unicorn illness of XYZ, I have histamine intolerance 1.369, histamine intolerance 1.369, and Dr. Maggie Yu, and you're going to find some case study of somebody I've worked with that been able to really turn around a really difficult case or many cases of something like this, right? So you need to be getting curious, really open in order to be successful.
Can't make it up. Kimberly says, Dr. Maggie fixed my gastroparesis too.
I fix gastroparesis for breakfast. Give me some lunch. Give me some dinner, please. Woot. Right? And here's the thing. I can't help you by you watching this training. Okay? You can help yourself by being open, curious, asking better questions, right? And I'm going to say, talking to us about what's going on with you. Because I absolutely agree that every single case is unique. And everybody has so much in their history and in their experience and in what they already know that's true about themselves that actually will tell me and our team exactly what are some of the root causes that are going on, right? And I mentioned before, and if you're still here, you're ready for this, okay? So I could put into 5, 6 major buckets of the underlying root cause of any symptom, any disease, autoimmune or not. But if you suspect that you're dealing with an autoimmune, if you already know you're dealing with autoimmune disease and you suspect that some of your symptoms or all of them is related to the immune system, then I put together a 30-minute action-packed training that goes over what are these causes, okay? Because if you don't know what's causing the problem, you can't fix it. That's the biggest takeaway I want you to have here. If you don't, it doesn't matter what the name of the problem is.
You don't need a diagnosis per se.
You don't need a diagnosis or a label to start healing. Okay, write that down. You don't need a diagnosis or a label to start healing. And many people and many doctors are waiting and waiting and waiting for that diagnosis that never comes.
Yeah.
And
well, somebody mentioned it up higher. She's been dealing with symptoms and even a positive ANA for 8 years, but doesn't know where to go. So we've been sitting in that, process for 8+ years, and we're not getting any better because we're targeting the symptoms.
Look at Queen of Hearts quote. I don't know who that is, right? But without a crystal ball, I have a crystal ball here, right? She says she's had a positive ANA for 8 years. That's not the problem.
No.
But that's seen as the clinical problem, meaning like we're going to keep following this and we'll do more and more tests. Just wait and see if there's something that we can put a label on.
We'll wait to see how much worse you get.
Meanwhile, she's a sitting duck. She is and has been a sitting duck for more and more symptoms to add on, right? And people are saying it's not related to the ANA. It's not related. That's not the right question. She already has this major clue sitting here, a positive ANA, meaning one of the major antibodies against, DNA in your body is already positive for your immune system hyperlabeling it. That means that she is already under active immune system attack. That's what a positive ANA means, is that there is already parts of your immune system that's hyper triggered and starting to attack, or not even starting, could be in the middle of an attack, but because there isn't a test to label what the areas that are under attack is, none of all that shit is related. And so the question is not about her positive ANA. I would say, Queen Hearts, if you want to list all the different symptoms now that you've had all these years, there's going to be a pattern here that's been missed by all these different doctors, right? The hematologist, the blood doctor, ain't got nothing for her. Well, what do you think? It's not a blood disorder.
Right. And she mentioned she has, when I said you're going to bounce around to different doctors, she said that's exactly what happened to her. She's been to the rheumatologist, the neurologist, all of the ists, right? Infectious disease specialist. And she's not getting answers.
So I'm here to tell you that I really I want to tell you how I solve this is identifying those root causes in each individual. Right? What are the 5-6 root causes of any of these syndromes? And instead of sitting here waiting for a label or anything, I'm going to say, how do we solve this piece? How do we solve this piece? How do we solve this piece? How do we solve this piece for each individual? What's the right order going about this? Right? And how do we do that? Because for each person, that's going to be different. That's why it's really important for us to talk to you. And I'll put a link in chat, by the way. If you are in the open and curious and you're actively seeking a solution to the problem rather than a label or a diagnosis, right? Then, scan that and get on a phone call with us because I want to talk to you. We want to talk to you. Without talking and knowing about the particulars of the situation, it's really difficult to know how we can help you, right? But this is a real thing. This is a real multisystemic immune symptom targeting disorder. That's real. And every single person who's been in the comments have it. Thank you, Claire.
Taking action. Yeah. Claire wants to change her life.
She needs to change her life because this is her life. This is the fight for our lives. And there's not an invisible enemy. It's a completely visible, clear enemy that has known causes that could be identifiable. And there isn't one medical specialist out there that's going to know how the hell to deal with this because it involves all these different systems. So instead of sending you to all the different systems and different specialists and apologists with this, is I'm focusing on what's causing this problem, root cause approach and identification.
And Maria is another testimonial. She did your program January to March of this year, and she said you have changed her life.
Maria, thank you so much. And Maria, if you're willing to share, I mean, how many people here, if you want me to do an interview or even a live interview with Maria, and share her journey. Put interview Maria in chat. I would love, Maria, I would love to welcome you to an interview, and we could even do it live so you can share your journey and your story with people. I mean, it's really inspiring. And Maria, type in chat if you're willing to share some of your history. What were your medical obstacles and problems that you identified during the program? What were some of the problems that were solved? Right? Type it in chat. Real people with real outcomes. Proof is the really important. And I absolutely, with an open and curious mind, we all should have some level of healthy skepticism. And you definitely should be saying, I want to see Maria's interview. I have gastroparesis. I want to see this person's interview. I want to see this person's case study. And I can tell you, no other doctor on the planet has 400 plus patient case studies and interviews with every diagnosis known, with people sharing where they were, what were the biggest breakthroughs, what was the root causes, and where they are now.
And I'm just going to pop the QR back up because people are asking for it again. So I see your comments. If you need that QR code, there it is.
And Allie, thank you for popping in chat here. Allie, she was on a group interview. We did a group interview with 4 case studies involving several young women with POTS, postural orthostatic tachycardia syndrome, dysautonomia and long haul. And she shared her story. And POTS out there is an impossible to treat unicorn illness. I want you guys to know that. And it's stuck in the cardiologist's office, okay, or the psychiatrist's office. So for me, that was if you guys, anybody want to have some resources or around POTS, who wants to learn more around POTS? I have a series of trainings and case studies around POTS where you can learn more to understand why this is a multisystemic immune targeting, symptom targeting syndrome. And some of the things that Allie and others shared was hormones have a lot to do with it. Digestion and food sensitivities, right? Multiple vitamin nutrient deficiencies and absorption problems, infection, nervous system, like all of these systems were some of the root causes of this problem. And it is fixable. It is really fixable.
So you're saying you have information that can be shared about that. And then you also mentioned that there was a 30-minute training.
Yeah, let's do this.
How do they get that?
Okay, if you want to get the my 30-minute succinct training that I put together on what are the root causes of what's going on with you, put in root causes or root cause training, put it in there. And someone from our team is going to message you, and I'm going to see if we can even put a link to it. It's a training that I put together, and I wanted to organize it and had diagrams to go over what are the 6 main areas that are triggering every single one of these syndromes here. That is really one major syndrome, right? So put reverse illness or reverse, what did I say? Reverse
root cause training, I think.
Root cause training. Put that in the chat. We'll get that to you, right? The other thing too is that if you stuck around this long, we talked about a couple other things like POTS, P-O-T-S. Put POTS training in chat, and we will also put a link or we'll send a message to you to get that training to you. And then I also, like, just so you guys know, I wrote a book, 8 out of the box ways to transform your health. It has been on Amazon in 10 categories, best-selling in 10 categories. And it's also an audiobook. I went through in each chapter what each of these root causes were for any sort of diagnosis or lack of diagnosis. So I would say definitely the book or the audiobook is also a great way. If it takes time, those of you who said overwhelmed, and you like to learn by reading a book or listening to it in an audiobook, that's a great way to get piece by piece, chapter by chapter, a rollout of what are some of these underlying causes and what you can do about it.
Now, you mentioned for people to ask if they wanted you to interview Maria. Many people said interview Maria, and then you asked Maria to share just a little bit more about her journey. She was hypoglycemic. She got
low blood sugar
last year. Here we go. POTS and heat intolerance, and she talks a little bit about how you were able to break through in the comments as well and get her some serious help.
Well, look at the heat intolerance. Like we're going into summer right now. Temperature is really heating up today. We're in Oregon, Washington area. I don't know what the temperature is right now, but it feels like it's in the low 80s. Heat intolerance as a symptom, I'm going to tell everybody not to ignore. It's not a little deal. It's actually a big deal. And it's a giant clue.
Oh.
There is so much going on with your hormones and with your immune system. That is a missing link for a lot of people.
And that's what she said you uncovered for her, was that she had hormone imbalances, among other things.
Well, and thyroid, look at her thyroid, which is a hormone problem. PCOS, polycystic ovarian syndrome, another hormone imbalance, right? And then I mentioned that these heat intolerance, whether it's hot flashes, heat or cold intolerance, these temperature dysregulation things, is actually a huge sign that you may be dealing with food sensitivities, digestion problems, histamine problems. Like these are all linked. And no one, how many of you have been told your heat intolerance or heat problems or hot flashes has anything to do with food sensitivities or digestion or thyroid, for example?
And you don't have to have obvious symptoms of it, because Maria says she never would have known she had any digestive distress, so she would never have guessed that food sensitivities were a big issue for her. But your program, your testing, your knowledge was able to uncover that. And transformation, once she cut out foods that you discovered were an issue for her.
Yeah. And a lot of people think you have to remove like those elimination diets. 70% of the diet on the planet, I'm going to go on the AIP diet and that's going to solve this problem. Do you know how many people I've seen? Because that's like generalized information that's personalized to no one. Like these elimination diets actually make people more sick. So I want you guys to remember something really important, okay? I have the highest level of certainty, period, out there that your problem can be solved. And the reason I have the highest level of certainty that your problem can be solved is because it's happened thousands of times before, and it's based on your data, your scientific evidence in your own body, and me educating you on the science behind all this. This isn't like your woo-woo elevation, levitation, energetic. This is what's going to be, you need everybody. This is very important to understand the science behind it. There's data behind it, and these solutions have to be personalized to you. And it has to be based on your education. And that's how you get results.
There's just a lot of questions popping up about working with you. How does your program work? How do you possibly get to the root cause when I have all of the symptoms listed? And this is the opportunity for those people who have these in-depth questions to probably talk to a member of the team.
Yep, definitely. So, you know what? It's on me. Okay. Scan that, book a call with our team. There's a link in the chat. I can't help you by you watching this, but I can help you if you will talk to us, because what you're telling us is going to be data for me. I need your data in order to know how we're going to be able to help. So definitely talk to me, talk to us, book a call with our team.
Okay, get more information.
Yeah.
Can you remind us once more the name of this syndrome, this symptom group?
Okay, write it down, because nobody else will tell you about it, because I named it myself, because this is what I see over and over again. This is like, it's MIST, MIST, write it down, multisystemic immune symptom targeting. Because just even understanding that the mist, which means that it looks from the outside like it's a mist. But I'm going to tell you something, and you're going to write this down. Mist is not a mystery to Dr. Mist.
And it's not something Dr. Maggie will miss.
I will not miss Mist, because I feel like I live, die, breathe, thrive, with solving that issue. It is just, to me, it is a readily solvable problem when people understand the patterns. So if you want to get better, period, talk to us, right? And, if you're in overwhelm, then take your time to learn more, right? Whether that's reading my book or the audiobook, or going to my YouTube channel right now and just searching for your symptom and my name, that will come up, right? So And if you're watching on YouTube right now, if you could subscribe to the channel, less than 5% of people watching this are subscribed to the YouTube channel, even though you're watching on YouTube. So if every single one of you click subscribe on that YouTube channel, my goal is to get to 50,000 by the end of the summer. So if you can help me get there, I would really love it, because you know what? Sharing is caring. And when you subscribe, when you comment under the YouTube video, when you take this and share with someone that can benefit from it, I would just love to raise the level of awareness around MIST and the role of the immune system, and how there are multiple symptoms around the body can be targeted and can be solved.
And share the name of your book once more. People are asking for that.
8 out of the box ways to transform your health. Okay. It's on audiobook as well. And I narrated it.
I love that. I remember when you were, that's so nice to get to hear your personal story. And you started this off as well, Dr. Maggie, by sharing a bit of how you did live this, and you have come out on the other side and you fixed this for yourself. Just to share your own results, you mentioned premature menopause at the age of, was it 36?
Yeah. And I'm going to ask people to type in chat some numbers. At what age, put a number in chat right now, did you first notice that hormones may have something to do with some of your health issues? To go back, think back earliest to when was my first hormone related symptom, and just pop that number in chat right now if you can, right?
And I'd love for you to also share what happened with your menopause journey after getting well.
Oh, that part. Okay. So I was diagnosed with early menopause at the age of 36. One of the gold standard blood tests is FSH. FSH was in the 80s. And they wouldn't test my other hormones, but they told me FSH, which was 80s, meant that I was in medical menopause. So after discovering that, there was really, they said, go on some birth control pills and antipsychotics, which literally made me fatter, madder, and meaner. And so it wasn't until, and that was when I actually went and discovered and started to learn a lot more about hormone testing, bioidentical hormones. And I ended up learning a lot from, functional medicine providers about thyroid testing, and then autoimmune disease, because the thyroid is actually one of the most common targets of autoimmune attack. And then when I actually started to test myself 2 years later, I ended up diagnosing myself with Hashimoto's and autoimmune disease, which my endocrinologist said, doesn't matter. It's not important. I don't care. Right? So here's what happened. When I figured out it was an immune system problem, I started to implement some of the things to figure out, what do I do with this immune target? What do I do with this immune target? What is an approach around this? Started thinking about digestion, hormone balancing, food sensitivities, blood sugar, right? And within 18 months from my diagnosis with early menopause, my periods came back and I came out of menopause. And here's why. I wasn't in permanent menopause. I was in an immune system attack state of my hormone making organs. So I had an immune system induced menopause that was inappropriate for my age. And when I discovered that it was my immune system and it was an autoimmune issue for me, and I learned how to turn off the attack, it turned off the attack against multiple organs, right? So my thyroid symptoms improved. My ovaries started to make hormones and I came out of menopause, right? My fibromyalgia resolved. My nerve pain started to get better. My ADD suddenly started to disappear because it was my pain hormones under attack, right? And for the next 10 years, I had normal, regular periods and hormone balancing, living better and better in my life until age of 48, when I finally actually hit real menopause, and this time really gracefully. Thank you very much.
So I love for you to share that story, because so many people are dealing with it and wondering, somebody even said, I always know it's hormones behind a lot of my root cause things, but my doctors can never verify that. And when your cascade, when you worked on it and you went out of early menopause and then gracefully entered it at an appropriate age, all of these other bodily systems were also getting better as well. So
I don't like whack-a-mole. So for me, if you're really hitting the root causes of this multisystemic attack, what's causing this problem, you can actually stop the attack against hundreds of targets at the same time. This stops people going from specialist to specialist to specialist that don't know anything about any other systems. So why focusing on these root causes and identifying for each individual is so critical: time saving, life saving, money saving, quality of life saving, period. So for me, the earlier, quicker you intervene with identifying the root cause for each person based on data, the earlier you can actually have people return to living their best life.
Yeah. And Kimberly is more proof as well that hormone balancing drastically improved her POTS. People aren't thinking about those things as being connected, but you are.
Correct. So that's why a big part of my work involves hormones. So in most of my programs, one of the biggest pieces is actually understanding how to measure hormones, how to identify what those patterns are that your doctors have no training in. What are the underlying causes of that? What are the immune system involvement in that? And how to calm and balance your hormones naturally. That's like a huge,
You can do it in menopause. Sherry is asking, but how do you do that in menopause?
You especially need to do that in menopause. Oh gosh.
Great question. And I understand why you ask it, because so many people are thinking like that as well. Like, what do you mean? My hormones aren't as wild and, revved up as they were when I was pre-menopause. But
think about this. The oldest person that I worked with a hormone imbalance that was triggering her lichen sclerosis autoimmune disease was an 84-year-old woman with PCOS, polycystic ovarian syndrome, that I identified at the age of 84. And her doctor says she had no hormone problems because she's not supposed to have any hormones. Bull. And that it had nothing to do with her lichen sclerosis that she had for almost a decade, that really ruined her quality of life, when it had everything to do with her hormones, had everything to do with her immune system. And not only did she have lichen sclerosis involving her skin and mucous membranes, but there were all these other signs of other targets that were under attack as well, right? So the connection can be made at any age and needs to be, and the sooner and earlier it is, the better.
I love it. And people are wondering, so your immune system can cause anxiety symptoms.
Even yes. And I mentioned just one thing. So I mentioned, Steve, in the beginning that one of the branches of the immune system is the allergy system, which involves histamines. And histamines isn't just an allergy molecule. Histamine in the brain is what we call a brain hormone, brain neurotransmitter. So fluctuating levels of histamines, high and low, actually triggers anxiety and brain fog. So is it all in your head now? Or is it that your doctor's just ignorant and doesn't understand the role of histamines in the brain hormones as a brain hormone? Gosh. Absolutely, histamines, right? There you go. Okay. And I'm going to tell you guys, if you are dealing with mast cell histamine intolerance, that's something I have done a ton of trainings on, and we have case studies around as well. So if you want to write MCAS or histamine help in chat, a member of our team can chat with you to learn a little bit more about you and share some case studies or information with you. Or you can do it the other way around, which is book a call with us and talk to us, tell us what's going on with your mast cell or histamine issues. Because it's not just an antihistamine and allergist problem at all. In fact, allergists don't know what the heck they're doing with this because it involves so many other systems.
You've really given us a lot of resources and a lot to think about today, Dr. Maggie. There's multiple trainings. You've given us ways to access those trainings, and to just search on YouTube as well is another great way. You could spend hours and hours going on your YouTube page and just educating yourself about how to really get answers and understand what is happening with your body when your doctors cannot.
And the first step is I'm going to say is, if you are asking questions around this, we can direct you to the right resources. We can help you identify what is the area in your history and your data that needs the focus first. Not only what is the right thing to do, but what's the right order? What should I start with, right? The answer to overwhelm is education and mentorship, expert guidance. Okay. So it's an openness to learn, it's mentorship and education, it's guidance here, right? So access us, talk to us, and there's your link to do that. Okay.
Thank you so much for this, Dr. Maggie. We appreciate it.
Thanks, everybody. Have a wonderful day, and I will see you guys on our next Table Talk Live. Thanks, everyone.